It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hello, I'm Dr. Annie Varughese, and welcome to another episode of Best Docs Network, where we feature some of the finest doctors in Houston. Today, let's meet bariatric surgeon Dr. Robert Marvin.
I kind of came to a realization that I obviously was not healthy, and it got to the point where it was kind of borderline embarrassing going shopping, and I would shop for clothes and I would cry in the dressing rooms, and I realized at that point it wasn't 5 pounds that I had put on, it wasn't 10 pounds, it was I had gained about 100 pounds without really even, I can't say I didn't know it, but I think I was kind of in a state of, well, denial.
Stephanie's lost all of her extra weight, so that's ideal. That's not, we don't expect that, we hope for that, and she's achieved that. She's achieved it because the surgery's given her a lot more control, but she's exercised that control.
I got the surgery March 5th of 2012, and currently I've lost about 115 pounds.
She's really changed how she eats and limited it to very healthy things, natural things, local organic things, all of which have pretty much a low glycemic index. She's cut out almost all the animal fat out of her diet, and that's ideal.
Everything has changed. Just a different joy. My kids are proud of me, and at work, working is easier. I realized that it was absolutely the best thing that I ever did, not only for my life right at this moment, but for my life forever.
Her whole approach to eating has changed, and she's involved her family and friends and coworkers in that, and that will produce an effect known as the halo effect, which is that patient having the weight loss surgery can actually transmit better lifestyle to some of the people around them, and those people actually benefit from that.
And so everything has changed. How I saw myself, how I see myself, how I see food, how I cook, how I shop, everything. Totally, like, I feel like a totally different person.
In today's Ask the Doctor, Sarah from Kingwood has a question for Dr. Annie. What is high blood pressure?
High blood pressure is a measurement of 140 over 90 or greater. That means the systolic blood pressure is 140, the diastolic blood pressure, or the bottom number, of 90. Anything above that is high blood pressure. Recently, data has shown that even blood pressure in the 130 over 80 range can be borderline high blood pressure and should be evaluated and treated. High blood pressure can cause many diseases, including coronary artery disease, can affect the blood flow to the kidneys, can cause kidney failure, can cause stroke, and multiple other problems. So it's an easy thing to treat if it's found. Again, the problem is high blood pressure is not found because it's a silent killer. Check your blood pressure with your doctor. Make sure you have regular checkups, and that can be a great prevention therapy for you with regard to high blood pressure.
My symptoms are, I don't want to walk on the ball of my foot. It shoots sharp pains up my leg. I mean, it feels like a nerve's being pinched off.
Wanda is a patient that presented to my office complaining of shooting pain. down her heel, up her leg, and so immediately I started thinking maybe there's a possibility of a nerve, compression.
I told him my symptoms. He suspected what it was. He wheeled in a little mini ultrasound machine, did it right there on the spot, and diagnosed the problem. And we set up surgery because I had already tried other treatments with other doctors and it didn't work, and we were done. This is your ankle joint, and you have a major nerve that courses through here. There's a natural tunnel. It's called your tarsal tunnel. What happens is the tunnels get real tight and they clamp on the nerve, are the protective covering, which we call the flexor inoculum. The nerve tends to get stuck underneath it. So what happens is when the nerve gets compressed, it's extremely painful. What he's trying to do is avoid that numbness, and for most people it works. You basically take what's pinching the nerve off away, and you make room for it, and life goes on. And the advantage of this is, it's not a surgery where you're really held up for a while, where you have to, stay at home and you can't put weight, because I want the patient walking as soon as they can, because I don't want those tunnels to tighten up or to close up. So I want to make sure the nerves can glide. Wanda had tarsal tunnel surgery. She comes back to the office 3 to 5 days later, and just dressing change. No need for x-rays because we're not doing any bone work, which is great too, because if you're not doing bone work, it's not necessarily as painful. There's less swelling. And so 2 weeks later, sutures are out and she's walking on her own. I'm very happy. I've actually recommended him in all my friends that have gone to him, and they've had more extensive things done to them where, you're reattaching muscles and putting in screws, really crazy stuff. They also think he's awesome. The side effect that one has from nerve decompression is not pain, it's lack of sensation, it's numbness. And that's temporary because with time they regain their sensation, but it's a really easy recovery and it provides immediate relief.
Exactly what he could do for me and what the benefits, what the side effects, and it gave me an opportunity to just weigh the pros and cons of whether I wanted to go forward.
The treatment is to close all the veins that are running backwards. Any vein that is not pumping up out of the leg is only hurting, it doesn't help. And so by removing or closing those veins, you restore the circulation out of the legs back to normal.
The procedure itself probably took 30 to 45 minutes. I was able to get up off the procedure table right afterwards and walk. I did have improvement in cosmetically, which is a wonderful side benefit, but I also have decreased swelling, decreased aching. Really, it's very minimal.
She got a great result. Her swelling has gone away completely. Her pain has gone away completely, and her varicose veins have gone away completely as well.
In today's Ask the Doctor, Sandy from Friendswood has a question for Dr. Annie. Why is cholesterol important?
Cholesterol is very important because cholesterol deposition in the arteries causes plaque, and plaque can build up and decrease blood flow to the brain, to the heart, to the kidneys, to the legs, and many other areas. People can have peripheral vascular disease from high cholesterol, coronary disease, and actually have higher risk for heart attack and stroke. Cholesterol can be easily checked by blood panels, starting from regular cholesterol panels all the way to advanced lipid testing. This is an easy thing to do and should be checked even in childhood. Coronary disease and atherosclerosis can be actually found in young people, and atherosclerosis, deposition of cholesterol, can be found in the aorta, even in children down to the age of 5. So evaluate yourself, check out your children, check out your family, know that cholesterol is important, and take care of it.
We are 1 million strong. We are united behind a cure. There are over 1 million colorectal cancer survivors in the United States. My name is Charles Kelly from Lady Antebellum, and I'm in this fight against colorectal cancer because it actually hits pretty close to my family. My father-in-law was diagnosed with it, and the thing about this disease is it is preventable, and so I encourage everybody to go get screened. Let's beat this thing.
Even in 2013, stress incontinence and urinary incontinence in general is a very big concern for a lot of women. Often starts with childbearing, progresses as women get older, and by late 40s, early 50s, a woman may be noticing she's leaking urine when she coughs or sneezes, when she jumps, when she exercises, or for a lot of women, the problem is that she can't sleep at night because she has to wake up and urinate frequently. If you have stress incontinence, a very simple outpatient procedure will allow you the ability to exercise without losing urine and may free you from pads and diapers that you may be wearing. But just have to talk about it. In certain other types of incontinence, may require just medications to fill.
And Dr. Imtiaz can also treat her patients with a simple and common outpatient procedure.
So for urinary stress incontinence, my most common procedure that I do is something called a transobturator tape. It's a little mesh that's placed just inside of the vagina, and it sits like a hammock around the urethra. Urethra is the little tube that you urinate out of, and in stress incontinence, the control mechanism out of the bladder is weak. A woman doesn't have the ability to control when urine comes out. When we place this little hammock at the right spot, she will be able to hold urine and be able to cough and sneeze without losing urine.
Thanks to Dr. Imtiaz and these procedures, patients no longer have to live with this very correctable problem.
Now, the interesting thing is that even in today's day and age, women aren't talking about it, and it's a very common problem. And the funny thing is it's a fixable problem, very easy fix.
For more information about any of our doctors on any of our shows, go to bestdocsnetwork.com or email us at info@bestdocsnetwork.com. Now let's meet Dr. Guy Lewis, who specializes in cosmetic dentistry.
I travel quite a bit for a living, and I noticed in an airplane magazine that Dr. Lewis was advertising for cosmetic dentistry, and never gave it another thought until I tried to get my teeth fixed back where I live. And I found that I had to wear braces for quite a few years, and that wasn't a good alternative for me, so I did some research. I don't know if there's cosmetic dentists up there, I'm sure there are, but I just didn't investigate it, but I did investigate this one and thought, well, this looks like a good as any, and if he's going to advertise in an airplane magazine, he must be pretty good.
So he sent me a lot of pictures and stuff before he came, and I knew I could help him out. And so he came in one night and got here late, and we stayed and took care of him, prepared his teeth, made him some temporaries that looked fabulous, let him go home, and then came in and we put them on, and he's just been really happy with them, and it made a big improvement on his smile.
I spoke with Christine quite a bit, more of a consultation type of format, because obviously I kind of skipped a couple of steps in the process because I live so far away. but very helpful. Christine kind of explained the process, what was done, what's going to be done, how it works, and getting the quotes and the pricing and everything. So it was very consultative, very helpful.
We did prep veneers on him, but it was not extensive. I mean, just because you have to prep the tooth doesn't mean you have to take it down. A lot of people think, oh, you're gonna have to take my tooth down to a little nub or something like that. No, sometimes it's just a matter of a little smoothing that is very, very minimal.
I was getting pretty self-conscious of when I would laugh or smile of putting my hand over my face, because I was just, oh, that's funny, something like that. And what I found is it's somewhat liberating to the point where I find myself not doing that anymore, which is nice. I mean, actually, when I smile for a picture with my family and my kids, I actually smile instead of, kind of half smile it. And they were always making fun of me for that. So very happy with the results. The staff is very professional. That they obviously know what they're doing, but the results are fantastic, really are.
It doesn't have to be a trip to the dungeon. It doesn't have to be uncomfortable. I would just say, come in and experience it, see for yourself. It really can be very pleasant.
Depression is a very common and a very bad disease. It's different than sadness. Sadness is what happens when you go through bad times in life, and it just tends to come and go in all of our lives. Depression is an abnormality of the chemicals in the brain that brings on a lot of bad symptoms and often needs treatment with medications. The two main questions you should ask yourself to decide if you're depressed are these. Number one, have I felt hopeless and sad for most of the time in the past 2 or 3 months? And number two, have I lost my interest in those things that I usually get a charge out of doing? For example, ball games with the kids, movies, certain meals, certain things on TV. If you've lost your joy in life, that's a sign of depression, and it needs to be treated. What can you do about depression if you have it? Well, you can do a lot. You can take medication. There's a lot of medications that work, most with few side effects. Exercise helps, getting adequate sleep, and counseling also helps. So there's a lot of ways to go from sad to glad.
I came to see Dr. Varughese on the advice of my primary care physician because my blood pressure was a little elevated and my EKG reading was a little off. She suggested that I take a stress test and have some other procedures done just to determine the causes of that. And it was determined that I did have blockage in one of my arteries and a stent had to be implanted. And then reality sunk and Dr. Varughese talked to me during the recovery time, and I asked her in tears, I asked her what was going on. I asked her, was I about to have a heart attack? And she said, yes.
Yolanda Garcia, to this day, she's so thankful that her primary care was cognizant enough to send her for evaluation, because many times primary doctors or nurse practitioners who see all of these patients, they may not recognize because the patient's not complaining much. So I think this is a wake-up call for all of us as physicians and healthcare providers to really focus on prevention, evaluating the patient early, getting them to the right specialist on time.
Because of her, I'm able to take care of my clients. Because of her, I have a better life. So I really am appreciative of all she has done for me.
Well, coronary disease in women especially is it's the #1 killer of women in this country, and pretty soon will be the #1 killer of women all over the world. And in Hispanic women especially, there's a high prevalence of diabetes. So therefore diabetes lends towards cardiovascular disease and coronary disease especially. It's just so important to educate our Hispanic population, our Indian population, because Indians die 4 times the rate of any other population from diabetes and cardiovascular disease. People are hungry for knowledge. It's just for the lack of knowledge we perish.
The symptoms is I had headaches, a lot of congestion, infections in the throat, a lot of mucus in the back, earetics, so much stuff going on.
Janice Martinez is a patient who came to my office complaining of nasal obstruction, facial pressure, constant headache. She has been treated under multiple medication, including antibiotics, antihistamine, nasal spray, without really, without any good success.
I went on, but then I started getting infections, and I was on antibiotics for 4 months in a row. They kept giving me, so I was like, this is not good.
So when we examined Miss Janice Martinez, we found that her natural sinus drainage pathway, it's obstructed by chronic inflammation, chronic infection. So we offer her the option of doing balloon sinuplasty.
The best part was the breathing. I could breathe again. The headaches, little by little, started going away. Now when I sleep, I would breathe real loud. My husband will always say that, and I don't do that no more.
So when you have a chronic sinus disease, that passage, it's obstructed, it's narrow by chronic inflammation, chronic infection. So what we do is we put a small balloon in the passage and we open up, you inflate the balloon and open up the natural passage, preserving the normal anatomy.
And I don't sound like I have colds all the time. Before I was like sick all the time. And now I'm doing great. I could go out, do everything, and I feel good.
One of the advantages is the quick recovery. There's really no downtime to balloon sinuplasty. The procedure can be done in office, under local anesthesia or the topical anesthesia with some nasal spray. There's not really a recovery time for balloon. The patient can go back to her daily activity the next day, and compared to a traditional surgery, which the recovery can last to a week.
Prevention and therapy of osteoporosis is one of Dr. Meredith Morgan's specialties. Dr. Morgan offers some suggestions that could help prevent this disease.
If a woman's normal, a healthy lifestyle should be adequate. The question about diet, nutrition, and exercise, part of life would be an active lifestyle. Weight-bearing exercise, say 5 times a week for 30 minutes, is good for cardiovascular, and it's good for the bones. So walking is great. So if a person can do that, that's the ideal for the bone health. Therapy is indicated on a risk factor. If there's been a fracture, it's obvious the disease exists. If there has not been a fracture, but the absolute risk projects to over 20% for a major fracture of the spine, arm, wrist, or a 3% 10-year risk of the hip, then drug therapy is indicated.
Dr. Morgan can adjust his treatment depending on his patient's lifestyle.
There are basically 2 groups of first-line therapy. The bisphosphonates, to use a big chemical phrase, and denosumab, which is a type of immune therapy. These have been proven to be effective and significantly reduce the risk of fracture. Highly, highly preferred to obtain our calcium in the diet. Just make it really short and easy, about 1,200 milligrams of calcium a day. In terms of nutrition, this is very serious. There is controversy, but there's enough evidence to indicate that a person who tries to treat osteoporosis only with calcium supplements or calcium and vitamin D supplements may have an associated 30% higher risk of having a coronary event, a heart attack. It's mainly theory as to why this would happen, and there are some people that don't believe it would happen, but in terms of the alternative managements of the disease or the high risk, we're talking about nutrition, supplements in a reasonable dosage, and the lifestyle of exercise and fall prevention.
Ablation therapy is used to treat arrhythmias that come from the top of the heart, known as SVT, or from the bottom of the heart, known as ventricular tachycardia, non-sustained ventricular tachycardia, or other types of arrhythmias. Now, ablation therapy sounds scary to most people, but it's really very simple. We take the patient to the cardiac catheterization laboratory, sedate them, of course, and then put catheters to find the area of the problem in the heart, and then easily make a tiny burn, and the rhythm is gone. So many people suffer so many years with tachycardias, palpitations, and these things can easily be taken care of with ablation therapy. So I think the news about ablation therapy should be given to the public. So many people are having atrial fibrillation even that don't know that they can get off of their medications by having ablation therapy. It's an interesting topic, something you should look up, and we'll bring more information as we get it.
Officer Wayne Schultz weighed an unhealthy 554 pounds until he met Dr. Robert Marvin. To find out more on Wayne's story and other life-changing stories, log on to bestdocsnetwork.com.
My teeth needed to all be extracted. They were crumbling, they were breaking, I couldn't chew my food.
He's a professional, an accountant, and he's certainly concerned about finances and how to structure his budget. And he was a guy that his lower teeth were worse off than the uppers. And so that was an area that he decided to focus on.
I guess this started in 2009, and this really happened in two settings. So that in 2009, we did the lower, and in 2011, we did the upper. The bottom is all done, and I'm in the midst of having the prosthesis on the top done.
And also with David, his concern regarding his budget, we were able to do this without grafting. Previously, in the upper jaw, because of the maxillary sinuses, we would have to graft those areas. In majority of cases that we were placing a full jaw worth of implants. But with the advent of cone beam CT, we're able to look at individuals from a three-dimensional standpoint radiographically ahead of time so as to know where the bone is, so that we can position implants within that bone and avoid the need for sinus grafting, and then subsequently lower his overall costs significantly, as well as increase the predictability.
No longer do I have to make sure that everything is in place where it's supposed to be in place. I have a new chance at a brand new set of teeth, and they don't hurt.
It's satisfying to see him come back smiling, see him walking down the hallway, standing upright with their chin up, smiling, and being much more confident. So it from a psychological standpoint, outside of the health benefits that you see, the mental health benefits are significant.
I'm a CPA. I meet with clients and of high net worth clients. Appearance is important to me. It's certainly not of the utmost importance, but it's important to me. And I don't want to be embarrassed by a crumbling smile line. It's a wonderful, wonderful solution.
Thank you for joining us for another episode of Best Docs Network, where we feature some of the finest doctors in Houston. For more information about any of our doctors on any of our shows, go to bestdocsnetwork.com or email us at info@bestdocsnetwork.com. For Best Docs Network, this is Dr. Annie Varughese, and I'll see you next time.